All right, so we're going to move on to our second lecture for this week, and that is the week of March 23rd to 27th, and this will be the last lecture of the material that we'll include in that exam too. Today we're going to be talking about government programs, most specifically Medicare and Medicaid. And so Medicare was a promise to our seniors and Medicaid a promise to our poor. Medicare and Medicaid are what we call entitlement programs. And what this means is that they are specific line items in the federal budget. They are not discretionary funds that get voted on every year. So that's what entitlement means and why it's called Title 18 of the Social Security Act. So Medicare is for the elderly, and it is both funded and operated by the U.S. government. So it's funded in large part through specific taxes that you pay. If you look at your paycheck, you will see that it is a specific line item tax that is deducted from your paycheck every time. So throughout your life, you are going to pay these premiums. This is a program that began in 1965 and by Lyndon Johnson. This was part of what he called his Great Society. All right, so this is also in part, to as much as we can, we pay through it through these taxes that are generated, and then also through general tax revenue. So who's eligible for this? As it stands right now, it's for persons that are 65 and older. And you will see there are different parts to it. We're going to get into those different parts in just a minute. So when you turn 65, you automatically get sent this card from CMS, which is the Centers for Medicare and Medicaid, and it is for the Part A or hospital part. So we'll talk about Part B in a minute. But it's not just for older people. It is also for disabled people. And so if you are deemed disabled by the Social Security Administration, then you become eligible for Medicare, but it's really not until like 2 years later. So you can't get it right away, and it is not that easy to get. So I just want to make that clear. The third category is people with end-stage renal disease. So they're in kidney failure. People with ESRD have to be on dialysis. This third category is a very interesting category, in my opinion. Why ESRD? There are lots of diseases that are terminal or kill people. So why this one as opposed to others? And so I bring up this point because it really kind of tells the tale of how policy is made and how laws are passed, and we're going to look at that a little bit later in the course. But this is what I would guess. For Lyndon Johnson to get this passed, there was probably some congressperson that had some loved one that had ESRD and did not want to vote for this. And so that was part of the horse trading that they did, that they said, okay, you include people with this disease and you will get my vote. That's the only rationale that I could think of why it would just be this one disease. But so here are the three ways that you become eligible. And so this 65, so remember, this was in 1965. And if you think of what the lifespan was and what a 65, because remember I'm 68, a 65-year-old person was like back then versus what they're like now. That's very different, but we have not changed this eligibility age. That is one thing if they wanted to try to fund the system in a better way. One of the proposals out there is to make this not people who are 65, but 68 or 70, and they would kind of phase it in every year. So I would not be surprised if this particular criteria changes at some point. So Medicare has 4 parts. Part A is the part that's for inpatient hospital services. Part B is the physician and outpatient services. Part C, I'm going to talk about a little bit more in a minute. That is managed care Medicare, which is called Medicare Advantage. But essentially what you do is, what happened is years ago, some smart insurance companies said to the government, you know what, on average you spend this amount of money per Medicare beneficiary per year. Pay us something like 90% of that. You can offload that risk and offload those people. We will offer a special Medicare Advantage and take care of all those healthcare costs. So they did. And this was almost eliminated under the Affordable Care Act because actually the insurance companies were making a pretty good profit margin. And so they figured out ways to market this effectively to more well Medicare people. And so kind of the healthier Medicare people were migrating to these plans, leaving the sicker and more expensive ones to regular Medicare. Okay, so it's somewhat controversial, but President Obama did back off of taking this out as part of the Affordable Care Act. So it's still out there, and that's actually the kind of Medicare that I am currently on now with United Healthcare through the state health plan. All right, so the 4th part is the newest one, and that is Medicare Part D, D for drug. If you get that one wrong on the exam, I'm going to feel sorry for you. Okay, so we'll talk about that a little bit more in a minute. So Medicare Part A covers what is deemed medically necessary. And so this is an important part because every year they come up with new treatments and that will be covered or not. And so a real quick example, my mother had some eye issues, but it wasn't quite macular degeneration, but it was similar to that. Medicare would cover macular degeneration, but not her specific thing. The shots, and they wanted her to have something like, what was it? Like 6 shots in her eye. Each shot was $2,000. All right, so then she has to decide. It was not deemed medically necessary because the science was saying at that point that those particular shots did not seem to be effective for her particular condition. Well, for her, she was losing her vision, which meant she was going to not be able to drive and therefore lose her freedom. So she was desperate and willing to do anything to save her vision. But this is how this stuff works. Now, what ended up happening to her, because she did not make a lot of money, was the drug company ended up giving her, she applied to this loan, this grant program, and the drug company ended up giving her that medication for free. All right, so lots of different tales in there, but part of what I want you to understand is just because we have this insurance does not mean it meets everyone's needs. And so it's something to understand too, when we start talking about Medicare for all, for the entire population, the devil is in the detail. And so is it going to be like regular Medicare now? Is it going to exclude certain treatments? Can it be written in a different way and be more inclusive that's similar to your Blue Cross Blue Shield right now? All right, so this is another tale in the things that we're looking at in this class. I mean, this is very, very complex stuff. And remember what our goal is. Our goal is for you to get enough of the 35,000-foot view that you can kind of understand what's going on. But then you would need to go and study in a lot more detail about each of these things. All right, so part A, the hospital part, you get by one of those three categories that I shared with you. If you did not work and therefore did not pay these taxes, I think you can qualify through your spouse, or else you then can buy it as well. Okay? One of the things I want you to understand is that though there is a lot of coverage, there are still those deductibles and co-payments with Medicare as well. So it's not like you just get all healthcare free. This data is a little old. The deductible in 2020 is $1,408. All right, so it's increased a little bit. So over 7 years, it's increased not quite $300. But the point I want you to understand is just because you have Medicare does not mean that you're not going to pay for care still. And it includes both deductibles and co-payments. I will not expect you to know these amounts. Part B, which is the outpatient and doctor part, is also medically necessary. So there's going to be a bunch of things that may not be covered, and I'll show you some examples of that in a minute. There was some concern as part of the Affordable Care Act that Medicare did not cover some of the preventive things, and so that is probably the biggest impact on Medicare by the Affordable Care Act. So there are more preventive screenings like vaccinations and stuff that are included now under Medicare Part B. You don't have to buy Medicare. You have to buy Medicare Part B. You don't just get it like you did in Part A. So if you are eligible, once again, but you have to pay a premium to get this. That premium, back then it was about $105 a month. But that premium is based on income. So this is one of the little surprises I got last year. I went on Part B last year. And so I'm like, oh, $105 a month. Yeah, that's affordable. However, it is income based. And so they looked back 2 years to see how much money I made 2 years ago. And they said, yeah, you're going to pay more than this 105. So I think mine is like 180 a month. All right, so I have to pay that premium every month to get this Medicare Part B. Okay, it too has deductibles and co-payments. So in 2013, that was $147. 2020, that is now $198. So this goes up every year, these costs associated with Medicare. And so that's in part of where seniors on fixed incomes with Social Security really want these what are called COLAs, cost of living adjustments, every year. They're like, you're raising my Medicare costs. You should be paying me more in Social Security. So here's just an example. I don't expect you to memorize this, but I want you to understand the kinds of things that are not covered by Medicare Part A or Part B. And so dental care, vision, hearing tests. I recently went and had an eye checkup with my with an ophthalmologist, and so part of it was about the medical health of my eye. That part was covered by my Part B. Because I'm in that Medicare Advantage, they also allow me to have one vision test per year. All right, but so here's a bunch of things. So you can see part of it, if you look down in the middle, prescription drugs are not covered. So they were not covered, and that was, drugs have gotten so expensive that this is creating like a really huge problem for elderly people of prescription drugs. And so we'll see what the solution to that was in just a minute. So with this Part A and Part B, just every doctor accepts Medicare that I'm aware of. That is not necessarily true about Medicaid, but Medicare, really all the doctors and hospitals I'm aware of that accept Medicare as payment. Now, with this, there is a special kind of insurance that you can buy called Medigap insurance or Medicare supplement. And what it does is those copayments and deductibles not covered by your basic Medicare coverage, you can buy an insurance to cover those. So essentially, you can be 100% covered, but you have to buy some extra insurance to get those. So the latest part is Part D for drugs. And this came in during the George W. Bush administration. And so this now allowed coverage for drugs under Medicare. However, you must buy an insurance to get this coverage. It's like Part B. You got to buy this. You don't just get it by virtue of being 65 or one of the other categories. It too is income based. So that was another bill I started getting. They're like, yeah, you make too much money 2 years ago, so you've got to pay extra money for drug coverage as well. Now, part of it is realizing it was not 100% coverage for drugs. And it created something that kind of had these first dollar coverages, and then it wouldn't cover you for a while. But then if your drugs got above a certain part, they started kicking in coverage again. This is what was called the donut hole. So when you hear people saying Medicare Part D and the problems with this donut hole, with the Affordable Care Act, they changed some of that to make that hole in the middle, that lack of coverage in the middle, a little bit better. So that's what they're talking about with the donut hole. Next, I'm going to move on talking about Medicaid. And the first thing we need to talk about here is some understanding of poverty. What does it mean to be poor in the United States? And so here's some examples of what is, it's based on your household income. And so I think we've talked about this in class, that the average household income in the United States is something around like $50,000, $52,000. Not individual income, household income. And so this will just give you an idea of if the average is 50, then this is what they consider poverty. And so this FPL, federal poverty level, is what's used to decide whether you qualify for certain programs. And just to give you an idea, if you worked 40 hours a week at minimum wage of $7.50, that's $15,600 a year. And so if you were an individual, you would not be considered poor if that's what you made in the United States. Okay? There's this discussion of we need to move to living wages, and indeed, the state of North Carolina decided about 2 years ago, I think, that all state employees would make a living wage defined as $15 an hour, and so that comes out to $31,200 a year. All right, so that's just some idea of what we're talking about in terms of poverty level and how that's used to determine whether you qualify for special programs. So Medicaid is Title 19. I don't expect you to know these title numbers. It too is an entitlement program of the Social Security Act. It too was passed in 1965 under Lyndon Johnson. All right, now here's a difference between the two. Medicare is operated by the federal government and it is funded by the federal government. Medicaid is a little bit different, and so with that, the funding comes from a mix that we'll see in a minute. But once again, it has a little bit different coverage actually than Medicare. The idea with Medicaid is you've got people who are socially disadvantaged and we want to get healthcare services to them. So there are things that are covered in Medicaid that are different than Medicare. Transportation would be one. So the idea is that we got to get you to the doctor because you do not have access to transportation the same way that average Americans do. These special coverages have driven new industries. So there are companies that just do transportation for Medicaid people, okay? So once again, a lot more detailed here, but it's a little bit different than Medicare. So with this, Medicaid is funded by a combination of federal dollars, state dollars, and maybe even county in some counties, okay? So it's different. Medicare funded all by the federal. Medicaid funded by a mix. But Medicaid is operated by the states, okay? So I want you to know those things. Who funds Medicare? Who funds Medicaid? Who operates Medicare? Who operates Medicaid? There are some deductibles and co-payments, but they're very, very small. But once again, from that moral hazard standpoint, they want you to pay something for it. All right, so the federal government does have overarching guidelines that states must follow to receive that federal part. Here's a list here, and one of the things, pregnant women are of particular emphasis here. We want pregnant women to get prenatal care as soon as possible. All right, so what I was seeing when I worked in New Orleans was that some women were using the emergency room to get some of their prenatal care. We actually opened a Medicaid sign-up office right there in our emergency room to get these women on Medicaid so they could start getting regular prenatal care through a physician as soon as possible. So here's just some of the criteria of how you become available. If you are under 19 and you have a needy family based on these federal poverty level guidelines, then you can qualify. If you have foster children, adopted children, then you also qualify. Also, low-income seniors, all right? So if you're a senior and you are poor, according to these guidelines, you can have both Medicare and Medicaid. And that's going to be important because there are some things that Medicaid covers that Medicare does not. Long-term care specifically. And when we study long-term care in a couple of weeks, we'll touch on this a little bit further. Also, if you're blind and disabled and on Social Security, you qualify for Medicaid. So you can be on both Medicare and Medicaid. Here's just some examples of what they're looking at to see who qualifies. I won't ask you specific questions about this. I just wanted you to get a sense of it. So each state gets some money from the government, and then they come up with their own criteria of whether it's 150% of the federal poverty level. Some have gone up to, I think the Affordable Care Act really wanted people to go up to 180% of the eligibility standards. But each state gets to decide. They also decide exactly what's going to be covered. They do have to meet those federal overarching guidelines, but they decide exactly, they might want to do other things as well. And so they also can set those co-payments and deductibles, and they administer it. Okay? Now, this is an important slide. You know, it's a bar chart, so this will be on the exam, so pay attention. This is what I want you to understand. Let's look at Medicaid in North Carolina. And let's look at first the pie chart on the right. So who is eligible for Medicaid in North Carolina? And you can see 71% of them are families and children. 12% are elderly. There are a few aliens in there. And 17% are disabled. All right, so that's, of the people on Medicaid, these are the proportions. However, look at the pie chart on the left. That is a different picture. Who do we spend the money on of those who are on Medicaid? And so while we have all these families and children, and you hear people making comments about that, that's not where we're spending the bulk of the money. The bulk of the money is going to the disabled, which if you think about it makes sense. If you are disabled, by definition, you have some medical health issue that you need help with. And so they're going to be kind of expensive people. The second, the light blue category is the elderly. And so a lot of those funds are going to the elderly because, yes, we know they use more healthcare services. But it also is this long-term care issue as well. And that is going to create a continued issue in the healthcare system that we will discuss when we get there. The last program I want to talk about is the CHIP program. So what this is back when Bill Clinton was president, they really decided that they were going to take a lot of people off of welfare. But there were concerns if they took people off of welfare there were going to be gaps, so that there were people that were really poor and they would be covered under Medicaid, but that there would be particularly children of these working poor. So they didn't qualify for Medicaid because they made too much, but they wanted to make sure that children had a good, healthy start. Okay, so they created this program called CHIP, the Children's Health Insurance Program, and it's called SCHIP because every state has their own program. All right, so what you need to know is, yes, there is a special program for that fills the gap between people that make more money and people that don't qualify for Medicaid. And so we just have a pie chart here that gives you some idea of, in North Carolina, who is qualifying for these programs. Okay? All right, so this graph here, so this is back to the Affordable Care Act. As I said, that, and I think I kind of misstated that what the Affordable Care Act wished to do was to get universal coverage, everybody on some kind of insurance. And so they wanted to look at people who had incomes all the way up to 400% of that federal poverty level. And so for a family of four, I think that was up to like almost $80,000. So some states went this high, and they're like, we're going to get you on Medicaid. Not every state agreed to do this. And in fact, this went all the way to the Supreme Court. North Carolina did not expand its Medicaid program. What I think looks kind of interesting is if you look at that map, for some reason it just kind of reminds me of that obesity map that we saw. All right, so we're going to talk about that more when we get to the Affordable Care Act. But that was a goal as one other way to get to this universal coverage. The other thing I just want to mention about Medicaid before we totally leave it, that not every physician accepts Medicaid. The payment for services under Medicaid is lower than Medicare and a lot lower than regular commercial insurance like Blue Cross Blue Shield. All right, so not every doctor will accept that, and this creates problems in some areas because particularly with some subspecialties that you can't get access to some of the care that you really need. This final chart is just something to help you study. So what is Medicare? What is Medicaid? Who operates or administrates it? Federal versus state. How is it funded? Federal versus state. And then some of the rest of this stuff is kind of the same for both. So this is the last slide in this section of the course, in the last lecture. Remember that our exam 2 is going to be Monday, March 31st at 2:30, our regular class time. You'll have an hour and a half, and it's going to be all multiple choice, and it will be online, listed under as a quiz in As You Learn. So we'll see how you do there. I know it's been a disrupted period it was going to be disrupted anyway by spring break, some of the stuff we had a long time ago. And so if you look at As You Learn, it's all those slides that in the test 2 part. So we'll see how you do. And so as I assured you, I don't want people to be harmed by the transitions that we made, and I just want to say I'm thinking about you and that I hope that you're doing well.